Hey future doctors, welcome to Pocket MBBS, where medicine fits in your pockets. Now let's study. Today's topic is anti-anginal drugs. Angina is chest pain or discomfort caused by temporary reduced blood supply or ischemia to the heart muscle without causing permanent damage. Causes of angina are coronary artery disease, anemia, hypertension, and aortic stenosis. Symptoms of angina are chest pain, tightness, pressure, pain radiating to left arm, neck, jaw, back, shortness of breath, sweating, nausea. Diagnosis is ECG and show ST depression. There are three types of angina: stable angina, unstable angina, and Prinzmetal angina. Stable angina, in which there is atherosclerosis that leads to narrowing of coronary artery. Unstable angina with MI is called acute coronary syndrome. There is endothelial damage that leads to platelet aggregation that leads to critical narrowing. Prinzmetal angina, there is endothelial dysfunction that leads to sudden vasospasm and complete blockage. Stable angina, there is no pain, it is stable at rest, and on exertion there is increased heart rate, increased oxygen demand that leads to anginal pain. In unstable angina, there is pain at rest which convert to MI, and it is the most dangerous form. Prinzmetal angina, there is pain at rest. Treatment for stable angina is sublingual nitrates. Nitroglycerin is used, which is 0.5 mg, and Isosorbide dinitrate 5 mg. Then unstable angina is managed as MI, in which aspirin is given and antiplatelet drug is given. Prinzmetal angina, chronic stable angina, which is a drug of choice for beta blockers, decrease heart rate and oxygen demand. Chronic vasospastic angina, drug of choice is calcium channel blockers and are not controlled. Then add long-acting nitrates via oral or transdermal patch. Anti-anginal drugs are nitrates, beta blockers, calcium channel blockers, potassium channel openers, and others. Nitrates, short-acting are glyceryl trinitrate, isosorbide dinitrate sublingual. Long-acting is isosorbide dinitrate oral, isosorbide mononitrate, erythritol tetranitrate, pentaerythritol tetranitrate. Beta blockers are propranolol, metoprolol, atenolol. Calcium channel blockers are verapamil, diltiazem, amlodipine, nitrandipine. Potassium channel opener is Nicorandil. Others are trimetazidine, Ranolazine, Ivabradine, oxyferidine, and dipyridamole. Beta blockers' mechanism of action is they block beta-1 receptor on SA node that leads to decreased heart rate, decreased oxygen demand. Drug of choice for chronic stable angina. There are two types of beta blockers, cardioselective and non-cardioselective. Cardioselective block beta-1 receptor more than beta-2, and it mainly preferred in treatment, and its drugs are metoprolol, atenolol, nebivolol, and bisoprolol. Non-selective block both beta-1 and beta-2 receptor equally. Beta-2 blocks cause vasoconstriction that leads to vasospastic angina. The drug is propranolol. Uses of beta blockers in angina, hypertension, MI, heart failure, and migraine prophylaxis. Adverse effects are bradycardia, hypotension, fatigue, cold extremities, and bronchospasm. Calcium channel blockers are of two types, dihydropyridine and non-dihydropyridine. Mechanism of action of calcium channel blockers is they block the L type of calcium channels that leads to decreased calcium entry into the cell, that leads to vascular smooth muscle relaxation, that leads to vasodilation and peripheral vascular resistance, that leads to decreased blood pressure, decreased heart rate, force of contraction, and oxygen demand. Calcium channel blockers are of two types, dihydropyridines and non-dihydropyridines. Dihydropyridines act mainly on vascular smooth muscle and they cause marked vasodilatation. They are used in hypertension and angina. They are drug of choice for chronic vasospastic angina. The drugs are amlodipine, nifedipine, felodipine, clinidipine. And the side effect is reflex tachycardia. They increase the heart rate and oxygen demand, increase the chance of stable angina. If combined with beta blockers, they prevent the reflex tachycardia. Non-dihydropyridine acts mainly on heart, decrease heart rate and AV conduction. They are used for angina, chronic stable angina, hypertension, arrhythmias. They are drug for choice for chronic vasospastic angina. The drugs are verapamil, diltiazem. Side effect is bradycardia and AV block. They should never combine with beta blockers because they cause bradycardia that leads to sudden death. Nitrates are venodilators. Mechanism of action is they decrease the preload, decrease the end-diastolic volume, decrease the duration of systole, increase the diastolic duration, increase coronary blood flow during the diastole. There are also coronary vasodilators that nitrates release nitrous oxide that leads to coronary vasodilation that is effective in vasospastic angina. Nitrates redistributes the coronary blood flow from non-ischemic areas to ischemic areas. It is called Robin Hood phenomena. The drugs are glyceryl trinitrate or nitroglycerin, which is given by oral, sublingual, transdermal, rectal, nasal spray or IV route. They are not given by subcutaneous or intramuscular injections because it is rapid metabolized and their poor and unpredictable bioavailability is seen. Isosorbide dinitrate is given oral and sublingual. Isosorbide mononitrate is given oral and it shows 100% bioavailability because it is not degraded by liver. Pentaerythritol nitrate is given orally. Properties of nitrate are it is highly lipid soluble and non-ionic. It has in oral route there is poor bioavailability. Isosorbide dinitrate is a prodrug that converts to isosorbide mononitrate, which is the active form. Shortest acting is glycerol trinitrate and longest acting is pentaerythritol tetranitrate. Now uses of nitrates are in angina, relieve the chest pain, acute myocardial infarction, acute left ventricular failure or pulmonary edema, heart failure and esophageal or biliary colicky pain. Adverse effects are hypotension, flushing, edema, reflex tachycardia, syncope or fainting. Monday disease is recurrence of nitrate-induced symptoms after returning to work on Monday, seen on workers exposed to organic nitrate industries. Cause loss of nitrate tolerance during the weekend. Nitrous oxide delivered by mitochondrial aldehyde dehydrogenase enzyme that leads to vasodilation, that leads to continuous administration of nitrates, leads to downregulation of MAD enzyme that leads to nitrate tolerance develops. Workers working on the nitrate industries are oftenly exposed to nitrates and become tolerant. But on Sundays, when there is a replenish of MAD enzyme, when they return to work on Monday, they show the nitrous oxides induced symptoms and it is called Monday disease, like throbbing headache, dizziness, flushing, palpitations and hypotension. Potassium channel openers drug is Nicorandil. Mechanism of action is potassium channel openers cause coronary vasodilatation, antioxidant actions, increase nitrous oxide formation, protect the heart and ischemic preconditioning, heart resistant to ischemia. It is used in resistant angina. Side effects with mouth or GIT ulcers. Other anti-anginal drugs are dipyridamole. Mechanism of action is PD3 inhibitors that leads to increased cyclic AMP, coronary dilators. It diverts the blood from ischemic areas to non-ischemic areas. That is also known as coronary steal syndrome. It is the reverse Robin Hood phenomena and it leads to worsening of angina, so it is a banned drug. Ranolazine. Mechanism of action is they blocks the sodium channel of myocardium that leads to decreased myocardial workload, decreased oxygen demand. They are used in chronic stable angina and add-on drug for resistant angina. Adverse effect is QT prolongation and block potassium channel in heart. Ivabradine mechanism of action is they block funny channel in SA node, decrease the SA node firing, decrease heart rate and myocardial oxygen demand and relieves the angina. They are used in chronic stable angina and chronic heart failure. Their side effect is visual abnormality, bradycardia and luminous phenomena. That's all for today's videos. Thank you. Follow for more such videos.